and welcome back to my channel, or welcome to my channel if you are new. For today's video, I have another health update vlog for you guys related to my brain tumor. For those of you who don't know, I was diagnosed with a more than likely benign brain tumor on my 28th birthday back in December of 2022, and the tumor is still there and it is still wreaking havoc on my body, and I've been documenting this entire journey. If you've missed any of those videos, I will have them in a playlist linked down below, but this is just going to be my update since my last video. I didn't think I was going to have as much for you guys as I actually do, but some big things have happened over the past few months. So in this video, I will be talking all about sudden medication changes, an emergency MRI, another MRI, my visit to the neurologist, as well as my ophthalmology follow-up. And if you guys would like me to continue documenting this journey, definitely let me know in the comments down below. And without further ado, let's get started. So today is March 12th of 2024, and you guys literally just saw my past update yesterday. If you've missed that, I will have a link down below for you guys. But I really didn't think I was going to be picking up the camera this soon. However, we have a major update and major change in medications. In my last video, I mentioned how I started up bromocriptine and how they just recently adjusted the dose. And unfortunately, the bromocriptine's not working out, and I am switching back to the cabergoline, which if you've been following for a while, I had a lot of side effects from. However, I was having more side effects with the bromocriptine. And with the bromocriptine, you take it every day, whereas the cabergoline, I take it once a week. So I would rather be miserable once a week rather than every day, and it's just been too much on me. So I did contact the doctor, and she got back to me today, and we are making the switch. So today is March 14th of 2024, and yesterday I actually got a call from my endocrinology office saying that they did in fact reorder my MRI to be for as soon as they can fit me in. I just got done talking with the scheduling office at the facility I will be having my MRI at, and I'm having my MRI today. Not tomorrow, not in a few days, not in a few weeks. I'm having it today. This was very last minute. Thankfully, I already had a dose of Ativan on hand, so I am going to be still taking that. And again, it will be in a, what they call wide bore open MRI. So let's do this. Today is March 20th of 2024, and today was a super exciting day because I just got back from my neurology appointment. I've been waiting for this appointment for months, and we had this appointment because of my loss of eyesight as well as the possible seizure activity. And let me tell you, the appointment went great, and I love my neurologist. I feel like he and my eye doctor are the first doctors to really take everything super seriously and show compassion and care, and he is just great. And so at the appointment, I was there for over an hour with him. We did a bunch of different testing. He went over my entire medical history. We talked in depth about everything, and we even got to talk about my headaches that I have. I literally live with a headache daily, and I've just learned to live with it. However, there are times where I do get migraines. I usually suffer from migraines usually 3 to 5 times a month, and they're pretty bad. I do have the Neurevio device. I will go ahead and leave a video on that down below, and it does help, but sometimes I just feel like I need medication, and I'm on a ton of medications, obviously, as someone who's chronically ill. And that was literally the first thing he said when he came into the room was, wow, you're on a lot of medications. And it is a consensus between all of my other providers as well, and so I've never really been put on headache medication, and the neurologist gave me rescue migraine medication, and I'm so excited to give it a try. Obviously, I'm not excited for the migraine, but I'm excited to see if it works. I believe I was prescribed rizatriptan. It is a little melt-away pill that you put on your tongue and let it melt on the onset of a headache, and you can take it up to 3 times a day. And they're also getting a prior authorization for a medication called Ubrelvy, which is also for migraines and headaches, so hopefully my insurance will cover that. It is a pretty expensive medication, so I'm not keeping my hopes up. As for what we are going to be doing moving forward, I will be having an EEG because they do want to assess if it is in fact seizure activity or not. The one downside is that there is a huge lack of EEG text, so it's probably going to be a while until I get in to have one. And another thing is that I literally have to have another MRI. I literally had an MRI less than a week ago, and on that MRI they were supposed to do stuff of my orbitals, and the note for that, in order for that, was overlooked completely, and they only just did the pituitary tumor MRI. And so he really didn't want to have to make me go through it again, but I told him if it's going to help in possibly getting a diagnosis and figuring stuff out, I'm more than happy to do it. So I have to go ahead and call the MRI place and go through the scheduling process again. This one is not an emergent MRI like the one from last week, which is nice, so I'll have more time to prepare for it. And we left it off with, it's a good thing that I got an appointment to go to Boston to Neuro Ophthalmology, because they are the big guys in this situation who are gonna know what to do and stuff like that. But in the meantime, my neurologist is gonna do everything that he can to help me, since I don't go to Boston until October 9th. And I think that's all I have for you guys from this appointment. Today is March 22nd of 2024, and I just got off the phone with the MRI facility and have scheduled my Orbital MRI, since they missed doing the Orbital on my MRI last week, and the neurologist really wants it because he thinks there could be something going on more, possibly structurally, than just the tumor, which is causing the eyesight loss. So he just wants an in-depth look, and so I am going to have another MRI, and this one will be on April 1st. I'm just excited it's not an emergency one and that I have time to prepare for it. I did go ahead and pick up my Advan from the pharmacy already, so I will have that for it, and I will probably see you guys then. Today is April 5th of 2024, and I am having my second MRI done today, and this is one that was originally supposed to be done in my MRI that I had, I think, 3 weeks ago. However, it was overlooked and never done, which meant I had to go back and get another one. And I actually have rescheduled this one. I originally was supposed to get this MRI on Monday, which was April 1st. However, they had to cancel it because they didn't have anyone to inject the contrast, which is a big part of the test. And I am about to leave now, so I will see you guys in a little bit. I just left having my Orbital MRI. This MRI was so much different. It was an immobile MRI trailer, and it was an experience. And right now my mom and I are stopped at Starbucks to get some coffee, and I also got a chocolate chip cookie. We are definitely people who like to stop and get treats after big appointments. So I'm back home now. That MRI was crazy. It was actually a mobile MRI that was done in a trailer, which I have never had to do before. It's normally just inside, and I usually have all the same techs, and it's been that way for years. This time they switched it up on us, and let me tell you, it was a bit strange. She walked me outside, had me stand on a platform, raised up the platform, which then brought us to this sliding door, which she opened. You walk in, it's a trailer, and then on one half of it is like the MRI machine, and then there's a door, and then there's like a little officey space. If for some reason I have to have another MRI anytime soon, I am going to be requesting that it be in the normal MRI room. Yes, I'm gonna be that patient, because I panicked the entire time I was having my MRI, because it is a space that is unknown to me. It was very claustrophobic because it was in a trailer, but fingers crossed that I won't need another MRI for quite some time. This was my 4th MRI that I've had in the past 15 months, which is crazy. I should have preliminary results soon, but I don't go see my ophthalmologist until the end of the month, where we will learn more about it. So that is where I'm at right now. Today is April 6th of 2024, and this is not tumor related, but I figured I would still include it because this morning at 3 a.m. I had to go to the ER. My right ear has been bugging me for a while, and ever since my MRI where I had to stick an earplug in it, it's been even worse. And by 3 a.m. I was absolutely miserable. I try to avoid the ER. I try to only go to quick care because the less people in the ER with minor issues, the better. However, I was so miserable that I had to go to the ER. And I was very shocked when I got there because for a Friday night, Saturday morning, the waiting room was pretty empty. However, I did find out that Outback was super full, and because of that, I ended up on the pediatric side because it was a room that they could stick me in. And so, final diagnosis is that I have a raging ear infection of just my right ear, and it's literally only ever my right ear. I'm at a point where it hurts to swallow. It's causing swelling from my cheek over. It really hurts to rest my glasses on top of my ear. I can't really really hear well, and I'm super dizzy. Right now it's about 10:30. I did get a little bit of sleep, but I'm still pretty miserable. And I sleep on my stomach for the most part, but when I do, I sleep on my right side. So it's been hard to sleep. But that's my update. I figured I would include it. I am not blaming my MRI yesterday, but in a way I am. Because I definitely think having to shove that earplug in there and have that sit in there for over an hour definitely didn't help the situation. Today is Monday, April 8th, and I figured I would give you guys a little update on the ear infection situation. When I was at the hospital, the only thing they did for me was drops, which I've actually been doing drops for the past 3 days because they were left over from my last ear infection, and she just gave me a new prescription and told me to continue doing them and didn't give me antibiotics. That was on Saturday, bright and early in the morning. Today, I just left my PCP's office because I was in a lot of pain. Everything is progressing, and I now have a pretty high fever. My ear canal is so swollen at this point that he can barely see my eardrum. So I am now on antibiotics, and we are praying that I don't get C. diff. I am a chronic C. diff patient, but that is where I'm at right now. Today is April 11th of 2024, and I just got a really exciting phone call from the neurology office. First off, he told me that my orbital MRI came back looking good. Obviously, the only thing that came up on it was the tumor, which we knew it would, but he said that structurally everything looks good, which is good news. However, it doesn't give us any more answers as to why I have lost so much eyesight in my right eye. Another exciting thing that came out of this phone call is that I was able to schedule my EEG, which is going to monitor my brain for any seizure activity, because I have been having little episodes here and there, and I will be having that a week from today on April 18th. Today is April 13th of 2024, and I've had quite a few updates for you guys this past week, and I do have another update for you guys. Yesterday, I actually went in for my follow-up blood work. Since restarting on the cabergoline, I had to do blood work 1 month from starting the medication, and I am happy to say that my levels have dropped significantly. I am now at a 6.0, which is within normal range, and at this point, I don't think my doctor is going to be doing any medication adjustments, and it is just such good news that my levels are finally dropping. So today is Monday, April 15th, and in the last clip I talked about how I have an EEG coming up this week on Thursday. However, that may be changing because since I finished the antibiotics, I think there's a high possibility that I have C. diff. If you guys are seeing this clip, then I most definitely do have C. diff. I just sent my sample off to the lab. I've had C. diff before. It's awful. I feel the exact same way. So now we play the waiting game, and if I do come back positive for C. diff, I will be going ahead and canceling my EEG and rescheduling it for a later date. So today is April 16th of 2024, and I just got a call from the lab that the C. diff toxin gene was in fact detected in my sample. I am still waiting to hear from the doctor on what we're going to do. I'm assuming we're going to be doing a round of vancomycin, which is what was done the last time I had C. diff, because this is not the first time I've done this. And I did call and reschedule my EEG. It is now on May 20th, so I don't think it will be included in this video. I may actually do an entirely just separate, dedicated, come to my EEG video with me. If that is something you guys would like to see, definitely let me know. So today is April 17th of 2024, and I just got off the phone with one of the nurse practitioners, and basically what has happened is I tested positive for the C. difficile gene toxin, and then they sent that off for another test. I actively have C. diff in my gut, but I'm not fully positive right now, is what she was saying. And so she consulted with the infectious disease team, and because of my history of C. diff, they are going to treat me as an active C. diff patient just so we can knock all this out. So I will be doing a 10-day to 14-day course of vancomycin, which is what I've done before, in hopes of knocking all of this out. They were trying to find a confirmatory test to send my sample off to. However, Mayo Clinic doesn't have one, and some other lab doesn't have one either. So that's why infectious disease decided we're going to treat you as an active C. diff patient, which is fine by me because I would rather have this treated and get it knocked out of my body, and let's hope that it works. And thankfully everything has been rescheduled. Today is April 26th of 2024, and I just got back from the eye doctor, and this will be my final update for this video. And this was a 2-month follow-up from my last visit. I did not have visual field testing like I normally do. We decided to skip it this time. However, the next time I I go, which is in another 3 months, which is the end of July, I will be having a checkup and visual field testing done again, just until I can make it to Boston, and that is one thing she's going to try to do. She's trying really hard to see if they can move my appointment up to be sooner rather than later, but she's not sure how much pull she will have in making that happen, which is absolutely fine. I'm just happy to know I do have an appointment. It just stinks that it's so far away. So that is just my update for you guys. I have no idea when or what my next update will be on for you guys, but that is where I'm at right now. Overall, I am doing pretty good. Like I said in the beginning, if you guys would like me to continue documenting this journey, definitely let me know in the comments down below. While you guys are down there, be sure to hit that subscribe button if you haven't already. I upload new content regularly and would love it if you'd become part of our little family. Also, be sure to hit the bell so that you are in fact notified every time I do upload a new video. I hope you guys like this video, and I'll see you guys next time. Bye guys!